My name is Chantal Mudahogora. I'm a psychotherapist. I have a master's degree in psychotherapy. I've been in this job for the last going my 22nd year. I mostly practiced in Canada because I've been living there for the last 25 years. So right away when I reached Canada, I was looking for something to do because they don't necessarily consider experience from back home. Before I left, I had a bachelor degree in business and in administration. So I worked for the ministry, few NGOs, the Ministry of Gender in Rwanda. So when I reached there, they don't consider, there's something they call Canadian experience. So they don't consider necessarily your education, your credentials, and your experience. So I had to start over. As a genocide survivor, I did not want to learn to go start from scratch, but I needed to learn something which will help me to understand myself psychologically, but also understand my community. So that's how I was interested to go to psychology. So I have 3 children. They are all adults. My youngest is 25, so you can do the math. Yeah, so for the last few years, I've been spending some time in Rwanda, going back and forth. I still have a few projects I work on in Canada, but I spend more time in Rwanda. So basically, in the end, I'm trying to relocate fully, but I still have to travel about maybe 3 times a year, go back to Canada. So I think that's almost about it. Here I do business. I came to Rwanda as an investor, but also I do practice mental health, mostly psychoeducation, because as you know, we still have a lot of stigma when it comes to mental health, not only in Rwanda, but in Africa and worldwide. So I try to focus more on young people, coaching them how they can recognize their warning signs of any kind of distress, whether it's stress, anxiety, burnout, even just to get to know themselves. I do a lot of psychoeducation on human development and different steps in life, which helps them to understand themselves, especially when you are young, growing up, family systems or family dynamics, understanding your emotions, understanding your thoughts. So that's where I focus more to raise awareness, because I know it's a big deal. In 2018, I published a research with my colleagues from Israel. We were working on intergenerational trauma, specifically within the Rwandan community, young people, post-genocide generation. So intergenerational trauma is real. It's not only for survivors, it's for anyone who have been going through hardship. So it's hard to explain in a short time we have, but I'm going to just give you a few facts. Scientifically speaking, a child starts accumulating parents' issues or struggles, especially mothers' struggles, when they're still in the womb. At 4 months already in the womb, a child or a fetus has already started accumulating some of the struggles the parents are going through. If there's a lot of domestic violence, kids may record, because at the time they are not conscious enough to know what is going around in their surrounding, but their consciousness is aware of what is going on. So they start accumulating information. If there's a lot of yelling, screaming, and maybe mom is very affected, especially if they cry a lot, they are sad, they are angry. All those emotions will actually be transferred to the baby in the womb, to the fetus. The good news is that also not only trauma gets transferred, but also resilience gets transferred. That's why you can see two siblings who grew up in the same family, same dynamics, but the outcome is different. So one will be stronger, will be more overcoming. The other one will be more of on a vulnerable side. So when it comes to intergenerational trauma, what makes it tricky even for the clinicians is that when as kids are growing up, especially in the teenagerhood, they start having weird behaviors, but they don't know why. Because they don't know where the behaviors are coming from, therefore they conclude that they are not normal. And then they start being depressed. For example, for me, who lived through the genocide as an adult, when I have my triggers, I know why. I know why I'm being triggered. I can give my personal example. I don't mind using a self-disclosure. I still struggle with whistle. Every time when someone blows a whistle behind my back, if I'm not aware and it just blows, my heart starts popping. Why? Because in the genocide there were so many whistles all over the place. They were using it to call the killers when they see someone hiding somewhere. So the whistle is still a problem for me, although now I'm getting better. But I know why my heart is jumping. But for a kid who don't know why they react on noise, for example, if a teenager goes in the nightclub, there's a lot of noise, shouting, everybody's screaming because the music is loud. They start reacting, but they don't know why. But the shout, the trauma they accumulated as in the womb, it's now being triggered, but they don't know why they're being triggered. So they start shaking, they start having anxiety attack, panic attack in the nightclub, but they don't know why they're acting such way. And they start, and even their friends, they're saying, "Oh, you're so weird. Why are you acting such way?" And they don't know. So at that point, this kid will end up hating themselves, thinking, "I'm not normal. What's going on with me? What's wrong with me?" They start hating themselves. They start withdrawing because they don't want to go in the public, so they want to be triggered again. And then it spirals from there. It will escalate, and they may get anxiety, but they also may get depression because they feel they are not normal and they don't know why. Mm. So it's more complex. The other thing is vulnerability. If you grew up in a family where you did not receive any care, affection, love, especially at a certain age, 5, 6 years old, at that time the kid is in the first phase of self-discovery, but they are discovering themselves as a gender. So a young girl they always get attached to the opposite gender among the parents. So a young girl will learn for the dad, will want to be close to the dad. They get jealous to their mothers, and if that kid does not have a present dad in the family, she will have a gap, and the boy will be the same. She will be glued to the mom. If mom is stressed and doesn't have time and keep pushing away, or would go there, like the boy will have a gap. Trauma is about fragmentation. It's about layers. So your mind, the thought gets fragmented, your emotions get fragmented to the point where when we do therapy, we try to melt those fragmentations so they can reconcile, they can work together. And the layers we try to deal with each and every one, how they come through. So this child would not have affection and parent and love, and parents were absent. When they grow up, teenagerhood, young adult, and even in adulthood, in their marriage, things start coming back. Because if there was a gap for me growing up, my dad was not present in my life, or I did not get the affection that I needed from my parents, I will always have that gap, and I will always long for someone who can fill that gap. That's how there's a saying we use in English which says we attract our own. Sometimes your wounds, your emotional wounds, will take you to someone who is also wounded, and then the wounds crashes. And Nowadays, everybody asks me, Chantal, why do we have so many divorces? Why? Why? That's what it is. And I will suggest the way I think some churches will go through some teachings to prepare couples before they get married. They should also seek counseling to make sure that they're on the same page, they understand themselves, they know their gaps, their vulnerabilities. Because if a young girl has made in her mind, like they made a narrative to say, when I will marry, my husband will fill up the gap of my dad's absence. What I did not get from my dad, my husband will give it to me. When I marry, someone has to provide this to me. But we know that no husband can play a role of a father, right? Mm-hmm. So at that moment, it's already a bad foundation. Because when you go in your marriage, your husband also, it's a give, it's a reciprocity. There's a reciprocity. You have to love them, they love you. You just don't take and reject. So, and conflict starts from there. So intergenerational trauma is very complex. Unfortunately, it's very common in many communities. It's not necessary for Rwandan community. It's not necessary for genocide survivors. It's common because for the genocide, it's to another extreme. You grew up in a family, and all of a sudden you have nobody left. You struggle as an orphan or whatever situation it could be. But also on a small scale, everyone may have one way or the other been traumatized in their lives. For example, these kids who are growing up in domestic violence families, these girls who are having unwanted pregnancies or teen mothers, they give birth in a lot of challenges where they have been rejected, they abandoned, they cry a lot, they are sad, they are angry, they are they have a lot of emotions, and these kids are growing up in such environment. Later on, they may cause some problems on them. So intergenerational is very complicated, but briefly, that's what I can tell you. Sometimes we have a combination of a number of things. Intergenerational trauma itself, it reflects in behaviors. And behaviors, they mimic so many things. They mimic depression. They may even mimic bipolar because someone is not emotionally balanced. They mimic even schizophrenia because someone have hallucinations. As you go through trauma, there's some defense mechanism you build around you so you can survive. It's a survival mode. You always survive in what you do. So you build things around you, and then in that process, someone may have the idea of something to protect them. And in that protection, they may hear voices, they may see vivid visual hallucinations. So PTSD does not reflect in one single thing, or intergenerational does not reflect in one single thing. What we see, they are behaviors. For example, people who have excessive fear. If you close the door behind them, they will jump like to the roof. They're always on knee jerk, always like jumping. Not unsettling behaviors. Always pacing, doing like strange behaviors. Withdrawal, isolation, lack of sleep. Or I should say sleep disturbances, because sometimes we see both extremes. Someone that cannot sleep, or they sleep too much, they don't want to get up. After 8 hours in the night, you still want to stay in the bed. We see a lot of people may be aggressive, and the aggressivity may not be intentional, but if they are very sensitive to the point where when they get triggered, they overreact. But it may not be intentionally. It could be because they are being triggered and they are protecting themselves. Lack of trust, any trauma, there are two main things. People who have been going through trauma, whether they are intergenerational or trauma they have experienced, they have been through, they have a hard time trusting. The trust goes completely. It doesn't matter what it is. Even if we just tell you, oh, I can drive you here and there, I may not trust you to go in your car. Because trusting becomes very, very complicated. And also they may not even trust themselves, which creates low self-esteem. You always self-guessing or self-checking or whatever. The second thing is control. They always have to be in control. If you put them in a situation that they have no control, they go wild. We don't know where we are going. We don't know what time we are leaving. We don't know who we are going with. Like, you try to go in an event, to attend an event, it's fun, you're going to socialize, but you get anxious because you are losing control of what's going on. Other people are just being, they're going with the flow, but you're not able to go with the flow.
You're super
alerted, like you have always to be hyper alerted. So, and sometimes people judge you. What's wrong with you? Calm down. Like, we're just we're chilling. Like, why are you going? And then you get so activated to the point where you're coming down, it becomes problematic. There are so many other symptoms: lack of concentration, lack of focus, memory loss. Like, it spirals to so many other things. And like, as we know, there's a slogan that we say, there's no health without mental health. Plus, mental health is like any other disease. If you have a concern or you have an issue, migraine, back problems, stomach issues, reproductive system problems, like trauma, or not even trauma itself, mental health disorder, any mental health disorder, like any other diseases, if you have high blood pressure or diabetes or any liver, kidney problems, heart problem, if you don't attend to those issues, it will get worse. Same thing within mental health, whether it's PTSD, depression, anxiety, whatever, if you don't attend to them, it will get worse. In Canada, I worked for dementia care, where people have Alzheimer's disease and dementia and other connected diseases. I worked in autism. I worked in different capacities, anxiety department and so forth. But in Rwanda, there's a variety of things. There's depression, of course, but depression, again, it's a factor which could be triggered by other things. You may be depressed because the other factors in life which are not going okay. If you have a chronic disease, it may cause depression because you have hard time to deal with this situation, or a pain in the body, a chronic pain, it may cause depression. But in the young folks, it's what you said. It's alcohol and drug abuse. It's more of anxiety attacks, self-harm, suicidal thoughts, family dynamics, disruption. So it varies, but mostly depression becomes an overall, but does not mean that many people are depressed. What it means is there are other factors which may cause depression. Mm. If you are experiencing some anxiety, there are two ways. Either you are depressed and the anxiety becomes a symptom of depression, or you have anxiety and then it may put you into depression. So there's a lot. It's very complex. You alluded on alcohol and drug abuse, substance, any kind of substance. It is true that alcohol, suicide, drug dependence, or addiction, there are things that can be preventable, because nobody gets up in the morning and starts killing themselves. It comes gradually. Same thing. Nobody gets up in the morning and become addicted. No, it becomes gradually. That's why we need to spend time raising awareness, which I'm very thankful for the media and mainstream media and other YouTubers, and now the space, Twitter space. We have to raise the voice. We have to let people know, because many people live with symptoms, but they don't tie it to their mental health. Why? Because there's a lot of stigma of mental health in Rwanda, in Africa in general, where when you have a headache all the time, the first thing you do, you run to the doctor, to the GP, and the general practitioner. They give you medication for painkillers, for this. They take your blood. Blood is okay. Nothing to suggest that you're having migraines. They tell you to drink a lot of water so you can be dehydrated. They tell you to exercise, try to reduce the stress. But the person does not tie the migraine to the way they think and their emotions. So therefore, they are looking for the physical pain, but they're not thinking about psychological pain. Same thing with the other symptoms. Crying from no reason, sadness, the chest tightness or palpitations, or those anxiety symptoms and panic attacks. Most of the time when people have chest tightness, the first thing they think, it's a panic attack, or it's cardiac issues, yeah. So they go to see a cardiologist. The heart is perfectly fine. And then they start panicking. So if the heart is okay, what is this thing is like almost choking me? They do x-rays, they do endoscopy, they do like all kind of things. But they don't tie those symptoms to mental health. So why am I saying the awareness is that kind of situation, where we know for sure when it is emotional pain and when it is a physical pain, or how can we be a combination of everything. So coming back to addiction, within our youth, we have a lot of people, they are overthinkers, there's a lot of self-sabotaging, there's a lot of imposter syndrome, a lot of negativity going on in their mind, and worry. Kwiheba, ikintu cyo kwiheba mu rubyiruko. The worry is too much, and then they start overthinking, they start panicking. My future, I don't have a job, I don't have a family, I don't have no one to talk to me, I want to go to, I don't want to go abroad. And they become obsessed about going to Canada, to America, to Europe. They become obsessed, therefore they're not looking for a future, they have exited, they don't focus on what is happening today. So when you cannot control your thoughts, and when your emotions are becoming too overwhelming, you start taking something to relax. Because your nerve system is so hyper, you try to relax it. So they use drugs, or they use alcohol. Alcohol, by the way, it's not used by young people alone. Even adults, they misuse alcohol. And we tend to think that is okay, but it's not okay. So for the young people, it's more complicated because, for example, someone who is a teenager, usually we all have the frontal lobe here. There's something I call a filter. There's a little filter, which helps us to function. What should I say in the public? How should I behave in the public? I don't go naked in the public. I don't say whatever to people. I have a filter which helps me to understand my environment, to assess my environment, to judge my environment, and then to act accordingly. But in the teenagerhood, that filter, the frontal lobe, is not fully formed. That's why they take too much risks. It gets fully formed. For the girls, it comes early, maybe 18, 19, 20. That's why you see that girls mature before the boys. Unfortunately for the boys, it may even last up to 22 or even 25 for some people. So that's not a criticism. It's the nature. It's how our brain is formed. So when the frontal lobe hasn't been fully formed, and you get into drugs and alcohol, it has a big effect in your functional ability. One, they have hormones. They have this high energy because that's the stage of development, human development they are in, to the point where no matter how much drug you use, how much alcohol you use, it takes longer to make you high. So you have to consume a lot in quantity of alcohol or in quantity of substance use to attain the level of feeling relaxed. Now, as you try to silence your mind and appease your emotional pain, you keep taking more. So you double the dose because your body is creating resistance. And then in the end, you become addicted. You become dependent first. Her Excellency First Lady explained it in lengthily in the last article and appearance she made. She gave some, how you start from happiness and then you end up in addiction. She gave the steps. So in that process, when you start using, people around you don't know that you are using to silence your mind or to calm down the traffic in your mind. They think you are just socializing. When someone starts becoming dependent, people may not even be there to help until someone gets addicted. But we saw the stages coming. Your circle, the close friends, will see that, but nobody calls you on it. Or even when they do, you deny it. Oh, guys, you're exaggerating. I'm okay. We tend to give too much value to alcohol. Alcohol means a lot in our culture. Back in the days, everything was about alcohol. You do something good, there's alcohol involved to thank you, to celebrate you. If you do something bad, there's alcohol involved to tell you that you did something wrong. Like, we cherish alcohol in a way that when it becomes problematic, no one cares, no one sees it. A small anecdote, I was in a wedding not too long ago where the parents, abasaza baje gusaba basabwaga, they became drunk like the first hour of the whole thing, to the point where the whole wedding, it was very funny, where people were laughing because it was really funny, but they have lost control in that gusaba protocol and being wise, like they were just being themselves. But you could tell that there was alcohol influence. So that in itself, it shows you how we are losing the capacity to limit ourselves when it comes to socializing and when it comes to being dependent. You have heard people who get arrested because they drive and they drink and drive, and then it happens once, second time, third time. Like, at that point, people cannot control themselves. They have reached the point where they can control. But as I said, all of these things are preventable. The symptoms are pretty much the same. What's different is that when you went through an experience as an adult, you know. When you see blood and you start jumping, you know why. But for a young one, they don't know. And plus, they don't have place in a society yet. No one will understand them. Young people will tell you, our parents don't understand us. When I tell them that I have fear, when I tell them that I'm losing control of my breathing or I'm shaking, they don't understand. They think I'm making it up. So as adults, we don't understand them. But the symptoms could be the same as adults. The only difference is because adults have awareness of their own symptoms. Young people don't have awareness. Recently, a young man told me, who was 2 years old in the genocide. And he lives in Canada, but he told me that he was working night shift and then will sleep daytime. And at one point he was telling me he's not able to sleep daytime because when he closes his eyes, there's a lot of dogs barking in the background, but there were no dogs. He's like, I think I'm going crazy. There are these dogs, every time I close my eyes, there's these crazy dogs barking like all over the place, and I have to cover my ears, but they still bark. I think I'm going crazy. I'm like, no, son, you're not going crazy. Actually, that's what happens in 1994. After the genocide, after the Rwanda was liberated by RPA, there were so many dogs in Kigali, so many dogs. Being 2 years old, he doesn't record this. He doesn't record the event because he was too young to understand what was going on. But his brain his conscious has memorized the dogs. And the matter of fact, it was in the month of April. You can only imagine a young kid who left Rwanda young. He's in Canada. He went through genocide when he was 2 years old. Now, 20-some years later, he's hearing dogs barking in his brain when there's no brain. when there's no dogs. So you can only imagine if he was alone, did not have a chance to talk to me and open up to me, he will go crazy. He will think he's being crazy because he was taking as he's being psycho. He's going into psychosis. So those are the things that young people struggle with and they don't know.
So speaking,
There are some recent researchers which are suggesting that is possible, but it's still undergoing. So I would rather not talk about it because there's a lot of debate among researchers talking about it. But trauma transmission, definitely, it can be intergenerational, and it can be, we see, for example, in the Jewish community where even seven or eight generation down the road, their children are still suffering today. They still have trauma, but that could have been because it has been passed through parents to parents to parents, generation after generation. So I would rather not talk about it because I cannot confirm it because there's a lot of debate going on about that. But for me, whether it's passed genetically or not, what I'm for. First of all, trauma or PTSD, it's a very new diagnosis. It hasn't been in this year. When was it? I think it was back in 1930s, when after the Vietnam and those wars, that's when they started seeing military people acting weird and drinking excessively. Shooting people, and then they started closely take a look into what could be the issue. That's when we started talking about PTSD. So it's a very new diagnosis to begin with. So I would rather think about how we can treat the people who are suffering than focusing on the research on that one. Because either way, we still have to have services, we still have to help people, we still have to support those who are suffering, who are emotionally in pain. One thing I was going to say, though, when it comes to treatment, all these things are treatable. Not only they are preventable, but they're also treatable. But with the stigma in African community and Rwanda community and other communities, it's hard to seek services because you think, oh, what they're going to do to me, what they're going to do. Like, not only you're not aware about yourself, about what's going on, but also you resist seeking help. So I want to encourage listeners that it's okay not to feel okay. Yeah. It's okay not to be okay. We cannot pretend to be invincible. We cannot pretend to be in control of everything. No, stress is a killer. And stress is our everyday life. Workplace. We are all working hard, like hours, like pushing hard, deadlines, Like there's a lot of demand in this life that we need to take care of ourselves. We need to be aware that these things can be treatable. Basically, let me give you a hint. People are always wondering what a counselor can do for me, what a psychologist can do for me, what a psychiatrist can do for me. I don't want to take the medication, like the Ndera medication. Like before you are mentally healthy and mentally unwell to the point where you go to Ndera, there's a huge journey in between. There's a huge spectrum. So you don't need necessarily to go to the conclusion that you're going to Ndera, because we can help you to prevent to go to Ndera. Because everybody can be candidate to go to Ndera. Going into psychosis, it's not something, everybody is candidate. But we need to make sure that the way we go to the doctor to do checkup, we should also do a checkup about our thoughts and our emotions. So in our practice, what we do, usually when you are going through trauma, there are many things which happen. So you end up being hyperactive. Your nerve system gets hyperactive. It points radars to protect you. The defense mechanisms and other things. So your nerve system is very, very alert. Now, what we do, because we are very powerful as human beings. What we help you to do is to calm down your nerve system and unleash the power from within. Unleash the power from your consciousness. Because usually when we are traumatized or we suffer from any kind of mental condition, we suppress our consciousness because the nerve system is too much activated. So we help the nerve system to calm down, and we unleash the power from within. Your consciousness will come to help you. So you don't have to be suffering. Trauma is part of mental health. Mental health is a broad term, but under mental health we have different. And we are talking trauma today, but there are very minor disorders or conditions which do not necessarily need a lot of workout, but if you don't attend to, like for example, someone who has OCD. Do you know what OCD is about? Mm. Yeah. So someone who has OCD, they have these traits, obsessive traits. They lock the doors 100 times in the night before they sleep. They overlook on the document before they submit it. Like, they overdo everything. It's so exhausting. So, yeah, in the end, your OCD will lead to depression because you do not get a good treatment. The other thing is ADHD. When you have hyperactivity condition, it's exhausting. You cannot focus on anything. Your mind is always scattered in 100 things at a time. And it is very exhausting. Living with ADHD without having help, without getting help, it's exhausting, it's a killer. But people live with it as if it is a normal condition. But it's something very easy to control. We just help them how to control the condition, and then they function normally. Mm. But people don't need to have to suffer. Even PTSD, you were asking if it is mental health or not mental health. So PTSD is under the umbrella term of mental health because mental health has so many conditions under that umbrella. So PTSD falls in that category. Mm. So whether it's PTSD, depression, anxiety, it doesn't matter what it is, seek help. There's no need to suffer in silence.
So would you assume that mental health or trauma can lead to long-term effects?
Absolutely.
Like which ones?
And that's the sad part. Well, addiction is one of it. Most of the time, addiction or dependent will actually damage other things. Heart, brain, your liver, your stomach, your lungs, everything internally. And your behaviors and financially, obviously. So we can treat you addiction. In the end, you still have a chronic disease going on. Maybe your liver was damaged, or maybe your stomach was damaged. So you heal from addiction, but you're dealing with a chronic disease. Same thing with any other things. Anxiety attack. That anxiety attack, actually, what happens within anxiety attack? I'm going to talk about this even if it is not the topic, because I know most of young people, they suffer from it, especially young girls. I don't know why. So what happens is when you start, when something triggers you, you have palpitation. Within that palpitation, your breathing is not regulated and your blood circulation is not regulated because you are hyperventilating. Now, it will start causing some oxygen deficit in your brain, or it will start causing some blood flow not to feed your brain. In the end, people may end up in the hospital. People may end up fainting because there's no enough blood circulation in the brain and there's not enough oxygen, and they end up fainting. So those things, you don't have to get there. There's a way to deal with anxiety and it goes away. Whether it's treatment or therapy, it doesn't matter what it is, but you don't need to suffer. So when you say that, what if PTSD, if all these things are mental health, yes, they are in the category of mental health. But in Rwandan community or in African community, when we talk about mental health, everybody understands psychosis. Psychosis is this condition you have when you go to Ndera, you lose control, you lose reality. So that's psychosis. That's the piece that goes to Ndera. Sometimes other people will go to Ndera as well for other things, even neurology, even whatever situation it could be. But you don't have to get to psychosis. But if you do not attend to your mild disorders or conditions of mental health, it may lead to psychosis eventually. You go into maniac behaviors or any other conditions. So it's important that people take care of themselves. But also, as we do these campaigns, we also have to recognize that we need so many ambassadors. This is not something you can do as just Minister of Health, as just professionals. No, it takes a community to deal with these issues, because we still have a long way to go for people to understand these things. Example, you hear every time there is domestic violence. If there is someone who becomes violent and they harm their partner or something, everything you hear in the news, oh, this couple was known as living in conflict by everyone, by the security, by the local government. Everybody in the village knew that these people are living in the conflict. But if we know, what do we do about it? Because there's a way to end this. There's a way to end this. But it's taking a holistic approach. It's not something that the Ministry of Health will do alone. It's not something that anyone who is aware or knowledgeable in this will do alone. It takes, like we used to say that it takes a village to raise a kid. It takes a village to care for someone who is suffering emotionally. So it's a call to every Munyarwanda, a call to everyone, not only the leader, but you and I, regular citizens. You know someone who is suffering. I know someone who is suffering. Let's all be ambassadors. You may not be able to approach them or to help them, but at least guide them and they look for support. And support is there, but is underutilized because the lack of awareness or stigma or whatever. And at this moment, Ministry of Health has decentralized the services of mental health. Even at the health center, you can find a counselor there. Mm-hmm. So, but we have to be aware. I've seen people. I was in the province the other day. I came across with someone who was drunk, and they were beating him. I was so mad. I had to stop the car and say, guys, get away. Because someone is a victim, is sick, you are re-victimizing them. And I've seen that with the parents as well. As parents, we also need to check in ourselves. Because if you have a kid, a son or a daughter who is struggling with alcohol or any other abuse, drug abuse or substance abuse, and when they come home, you are so mad because they come late or they come high and you chase them away. Where are you sending them? Where? To get and keep rejoining. When they come home, it's like they're crying for help. But if you have a son and a daughter who has malaria at home, you put them in the bed, you tackle them, you give them some potage, some soup, some milk. So you check their temperature, you care for them. It's not different. If someone has a stomach issue, it's not different from having brain chemicals issue. So I'm calling the community to take responsibility. We have to be brothers and sisters keepers. As I said, it takes the whole village to care for someone who is struggling, but we need to educate ourselves, seek information. If this family is living in this conflict, is the domestic violence, what's going on? Let's get involved before it gets too bad to the point where someone dies or someone is harmed. So the message I can give is to seek help. Seek help. When you say bite ni byiza, while you know for sure that is not byiza, there's a precedent to this. We are educated. We are raised up to be strong. There's a lot of expectation of someone to be strong. But we're all vulnerable. How can you be strong when you can't sleep? When you sleep, you cry the whole night. Your pillow gets wet, but you still have in the morning to put the makeup and walk on the street and say, "Hey, ni byiza." No, why? It's not, because we are told we need to be strong. You know how kids are raised up. Amazina, wachibgawe, wajichuchwe, nachuzimarira. You need to be strong. They beat you, you cry, they beat you again because you cry. So you go, and that's not okay. Emotions are part of us. It's okay to be emotional. It's okay to be emotional. The more you suppress them, the more you're sitting on a volcano. Because when it explodes, we don't know when it will explode. Because there's these things we call psychosomatization diseases. These are the diseases which comes because you're not emotionally okay. Maybe you have those migraines I was talking about. There's few organs which are very sensitive on mental health. When you're not doing well mentally, everything else will follow. So we need to seek help, and we need to know that it's okay not to be okay. But also we need to be our brothers and sisters keepers. There's a say I like from military family. They always say, no man is left behind. We shouldn't sit, be content, be happy, be satisfied if we know that there's a friend next door who is suffering. We cannot. How can we settle?